Hello friend, this is Rupa Yadav. Today I come with my video thyroid cancer. In a previous video I already updated the thyroid cancer. In that video I discuss about a causes of thyroid cancer, what's the purpose of the thyroid gland cancer and what was the risk factor about it, and last what happens during a thyroid cancer surgery or treatment. But dear friend, in this video I will discuss about types of thyroid cancer and its what was the stages in each and every part of the thyroid gland cancer. So friend, those who are not subscribed my channel, so go to with my channel and just subscribe it and press the bell icon and also like the my channel. Now let's start. Today, thyroid cancer. I want to understand you what before in my previous thyroid cancer video I already discussed about, but now in this video I will want to roughly understand you what was the thyroid cancer. What exactly is the thyroid gland? Thyroid is a small gland which is found in the neck in front of the windpipe. So, this gland is responsible for the production of the thyroid hormone. Now, the thyroid hormone is a very essential organ and it's responsible for it mainly required to maintain the metabolic rate of the patient, and without this thyroid hormone the person start becoming the losses activity, he become it start less active and start gaining weight and develop symptom of what we call hypothyroidism. Now thyroid is also one of the organ which can affected by cancer. Now we are discuss about the types of the thyroid cancer. There are the different types of the thyroid cancer. Now treatment is more or less similar for these thyroid cancer, but the outcomes may be vary and the follow or they they were doing treatment for this cancer may also be a commonest type we encounter in a country, the type called papillary carcinoma of the thyroid, which form majority of the thyroid cancer. The other type is called the follicular carcinoma of the thyroid. This cancer has more tendency to spread by blood to bones and can produce symptoms because of spreading to far off area. The third type is called medullary carcinoma of the thyroid. This cancer is important because it has a higher chances of having a familiar tendency that we can have in about 10 to 15% of the cases. Medullary cancer can be present in the multiple member of the family. And the last type is called the anaplastic carcinoma of the thyroid, which luckily for the form of minority because this is a highly aggressive type of thyroid cancer which cannot be effectively treated. Now I will discuss about the detection of the thyroid cancer importance. What was the importance of the detection of thyroid cancer? The thyroid cancer is one of the most curable cancer. cancer among the different type of cancer. So it's is very highly imperative that we detect thyroid cancer at a very early stage. Like I said earlier, most thyroid cancer are asymptomatic or do not produce any symptoms, and the only way it is noticed is in a form of a nodule in the or a swelling in the neck. So for early detection, it's required that any lady or any male patient with the swelling in the neck, especially in the midline, who need to the doctor at least once for evaluated evaluation for this swelling. More like I said earlier, also most of the swellings are harmless, and it can be just what we call a goiter, which may not give any problem to the patient, but it is required that at least once they get evaluated so that probability of thyroid can be ruled out. And it is very important that the patient does this, because this cancer who treated is a highly curable one. Now friends, I want to discuss about the stages. What was the stages of the papillary carcinoma, a mandibular carcinoma, follicular carcinoma, and lastly anaplastic carcinoma. Now first, TNM staging system. What was the system? Doctors used to describe the stage is the TNM, that is tumor, nodule, and last was the we already discussed about the mandibular medullary thyroid cancer. Now we are discuss in a briefly about that a TNM, in that first letter a T, tumor. Using the TNM system, the letter T plus a letter or number 0 to 4 is used to describe the size and location of the tumor. The tumor size is measured in a centimeter. A centimeter is roughly equal to width of a standard pen or pencil. The stages may also be divided into a smaller groups that help describe the tumor in even more details. When describing T in a thyroid cancer, doctors may subdivide the general categories by adding the letter S. The letter S to indicate a solitary single tumor, and last the M, which is stand or VR, indicate the multifocal more than one tumor. Specific tumor stage information, that is first point TX, in that the primary tumor cannot be evaluated, and T0, T plus 0, there is no evidence of a tumor. And the third point T1, the tumor in a 2 centimeter or a smaller and limited to the thyroid. T1A, the tumor is 1 centimeter or a smaller. T1B, the tumor is larger than 1 centimeter but less than 2 centimeter. T2, the T2 tumor is a larger than a 2 centimeter but smaller than a 4 centimeter and is limited to the thyroid. T3, the tumor is larger than a 4 centimeter but the tumor does not extend beyond the thyroid gland. T4, the tumor is of any size and had extended beyond the thyroid gland. T4A, the tumor in any size and has extended beyond the thyroid to nearby soft tissues and larynx, trachea, esophagus, and a recurrent laryngeal nerve. T4V, in this, the tumor has spread beyond the region in a T4A. And now we talk about node, which mean we stand for N for node. N in the TNM staging system stand for lymph node. Careful evaluation of lymph node is an important part of the staging thyroid cancer. There are many regional lymph nodes located in the head and neck area. Lymph nodes in another part of the body called distant lymph nodes. NX. In node, the regional lymph node cannot be evaluated. N0, N plus 0. There is no evidence of cancer in the regional lymph node. N plus 1, we stand N1. We also say N1. The cancer has spread to the lymph node. And the N1A, in this, the cancer has spread to the lymph node around the thyroid called the central compartment. The pretracheal, paratracheal, and prelaryngeal lymph node are present there. N1B, the last one is NAB. N1B, cancer has spread beyond the central compartment, including unilateral cervical lymph node on one side of the neck, bilateral cervical lymph node on both sides of the neck, and contralateral cervical, the opposite side of the tumor. And lastly, the mediastinal, the chest lymph node are present on the N1B. Now friends, we discuss about metastasis, which M, denoted by M. The M in the TNM system describe whether cancer has spread to the other part of the body, called metastasis. MX. In MX, distant metastasis cannot be evaluated. M0 means M plus 0. Cancer has not spread to other part of the body. And the last M1 means a cancer has spread to other part of the body. And we are here discuss grouping stage cancer, means cancer stage grouping, what was the stages are present there. The doctor assigned the stage of the cancer by combining the TN and M classification. For thyroid cancer, this system differ by a tumor type. For papillary or the follicular thyroid cancer, staging also depend on the age of the patient. Now, the friend, I want to discuss in a briefly that a papillary or a follicular thyroid cancer in a person younger than of 55. The stage first. In this stage, describe a tumor any T with or without spread to lymph node any N and no distinct metastasis M0. And the second stage, this stage describe a tumor any T with any metastasis M1, we called M1, and regardless of whether it has spread to the lymph node, I mean any N. Papillary or follicular thyroid cancer in a person 55 and older. The stage first. In stage first, we are describe any small tumor T1 with no spread to lymph node N0 and no metastasis M0. And stage second of papillary or follicular thyroid cancer. In this stage, describe a large non-invasive tumor means T2 with no spread to lymph node means N0 and no metastasis M0. Third stage, this stage describe a tumor larger than 4 cm but still contained in the thyroid T3 with no spread to lymph node N0 and no metastasis mean M0, or any localized tumor that is T1, T2 and T3 with spread to the central compartment of lymph node, that means N1A, but no distant spread M0. And the next stage, that was stage 4A. We are describing this stage a tumor that has spread beyond the nearby structure, that is T4A, regardless of whether it has spread to the lymph node mean any N, but it has not spread to distant places mean M0. Or this describe a localized tumor that is T1, T2 or T3 with a lymph node spread beyond the central compartment N1B but no distant spread mean M0. Now the next stage, that is stage 4B. In this stage, friend, we are describe a tumor that has spread beyond a nearby structure, that is T4B, regardless of spread to lymph node mean any N but no distinct spread, that is M0. And in the papillary or follicular thyroid cancer, the last stage, that is stage 4C. In this stage, the stage describe all tumor that is any T, any N, where there is a evidence of metastasis, that is M1. And we are discuss about medullary thyroid cancer. In this medullary thyroid cancer also categorized in a stage 1, stage 2, stage 3, stage 4A, stage 4B and last the stage 4C. And now we are discuss stage first, stage 1. In this stage, describe a small tumor that is T1 with a number no spread to lymph node means N0, a no distant metastasis means M0. And the second stage, that is stage 2, in this stage describe a large localized tumor, that is T2 or T3, with a no spread to lymph node, that is N0, or no metastasis means M0. Stage 3, we are talking about third stage, that is stage 3. This stage describe any localized tumor, that is T1, T2 or T3, that has spread to the central compartment of the lymph node, that is N1A, but has no metastasis means M0. And the next stage, that is stage 4A. In this stage describe a tumor that has spread to nearby structure, that is T4A, regardless of whether it has spread to the lymph node, that is any N, but it has not spread to distant place, that is M0. Or this describe a localized tumor, that is T1, T2 or T3, but lymph node spread beyond the central compartment N1B, but no distant spread M0. And the next stage, that is stage 4B, we are discuss here stage 4B. This stage describe a tumor that has spread beyond nearby structure, that is T4B, regardless of spread to lymph node any N, but no distant spread, that is M0. And the last stage of the medullary thyroid cancer, that is the stage 4C. In this stage used when there is a evidence of metastasis any T, any N and M1. And the friend, we are discuss about the last stage, that is the anaplastic thyroid cancer. On that, I want to discuss about anaplastic thyroid cancer. Here also categorize the stages, that is stage 4, stage 4A, stage 4B and the stage 4C. Here we discuss the first stage, that is stage 4. All anaplastic thyroid tumor are classified as stage 4 regardless of tumor size, location or metastasis. And the next stage of the anaplastic thyroid cancer, that is the stage 4A. In this stage describe any anaplastic tumor that has spread to nearby structure, that is T4A, regardless of whether it has not spread to a distant place, that is M0 means metastasis 0. And the next stage, that is stage 4B. This stage describe an anaplastic tumor that has spread beyond nearby structure, that is T4B, regardless of spread to lymph node, that is any N, mean any node, but no distance spread M0 mean no metastasis. And the last stage of the anaplastic thyroid cancer, that is this stage is used when there is evidence of the metastasis, that is any tumor, any node, any metastasis 1, mean any T, any N, any M1. And last we are discuss that recurrent. Recurrent cancer is a cancer that has come back after treatment. If the cancer does return, there will be another round of tests, and scans are often similar to those done at a time of original diagnosis. Thank you. I hope you enjoy my video. Thank you for watching my video.